So, I tell you, I've had quite a few times where I teared up because the pain that I'm dealing with is so much.
Rest. Exercise.
liquid in it with one drop coming out the end. Because I had been praying for healing for my wife and for my dad. And he showed me I wasn't praying exactly right. And second syringe had an amber colored liquid, one drop coming out the end. He said, if you'll pray for people to be filled with the Holy Spirit, nothing else can stay. Sickness has to go, disease has to go, anxiety has to go, depression has to go, bitterness has to go, unforgiveness. Unforgiveness holds back so much of God's blessings. It's one of the things that has to stop. Unforgiveness will hold back. I mean, it's a prerequisite to walk into the fullness of what God has. And so it really hit home. And then, you know, I kept trying to find a syringe like that on the internet so I could see it and print it out because it really hit home. And about 4 or 5 days later, he woke me up and had me draw it. And I draw like I sing, and I sing like I draw, so it's not very good drawing. And when our daughter was 4 years old, I was singing with the radio coming back from California. She stuck her hand over my mouth and said, "Don't sing, Daddy." This is a 4-year-old. You know? And so, you know, if we pray for people to be filled with the Holy Spirit, nothing else can stay. I'm going to show you the drawing, if that's okay. So, I tell you, I've had quite a few times where I teared up because the pain that I'm dealing with is so much. Literally moments before I even decided to just record this moment, my legs, not my legs, but my left leg, but unusually both of my feet is usually my left leg and my foot, but it feels like electricity. It truly feels like electricity right now. And this is me trying to sleep. It's crazy because some days it's like bearable, tolerable, and then some days, well, right now, it's probably the worst night of radiating pain. And I'm taking all these different types of medicines: gabapentin, naproxen, muscle relaxer, Tylenol. And I even went my way of, you know, researching different diets and stuff like that, because you also have to be mindful of what you're eating to not, you know, cause inflammation and flare-ups. So what I found was like pineapples, pineapple juice, berries, greens, food with high omega-3s like salmon, fish. So, you know, I'm just trying to do my part while I'm pretty much in the bed all the time. I've been in the bed basically for the last maybe 10 days now. And, you know, as you can see, I'm laying flat, and I have my legs elevated with a pillow. Really the surprising thing, if I haven't mentioned in a clip before this one,
But even though I'm going through my storm right now, I wanted to just record little fragments of what's going on, not only as a reminder, because I do have faith that this will be over one day. Of course, I hope sooner than later, because this pain I wouldn't wish on nobody. And for whatever reason, I'm going through it. However, I realize that it is genetics for me, as far as like the bone and stenosis. But also for those who've been following me in general, or those who may be new watching me up until this point and are going through hardships, or maybe even the same situation I'm going through. But it feels hard. It is very hard. And I ain't gonna lie, I kind of felt like, or I would say feel like, because it's my present right now. But I do have faith, and I do know and believe that, this too shall pass. I know I look ridiculous, and as you can see, usually I'm clean and bald, and my hair is coming back. And another thing is, sometimes I care too much. Well, let me rephrase it. I just want it to be real. So I feel rough. I look rough. I'm going through a rough time right now. And normally I wouldn't share myself in this type of way. I decided, or I would have gone the route of just kind of keeping this to myself. And then once I got better, then I'd share, or maybe not share this much, but at least just say, this is what's been going on. This is my trial and tribulation I'm going through. But I figure let me kind of record it in real time, just so people who are going through what I'm going through or something else, that you really have to trust and believe that it's temporary, despite how hard it feels. And as much as our flesh wants to say that you're defeated, or you feel like you've been defeated, or you feel like you won't touch back being normal again, this is where you have to tell yourself that you're going to beat whatever it is. I'm determined. And so, yeah, I have to kind of shake those negative thoughts out my mind. And a lot of times I think of my mom and just what she had to deal with by herself, going through 10 times worse of a situation that I'm going through right now. So a lot of times with what's going on right now, I tend to think about her. And my heart goes out to anybody who's dealt with anything truly severe. I don't want to name all the different types of conditions or diseases that are or qualify as severe, but that's why I always say, even in my good times, I always mentioned to my followers, and we're all going to have good times, we're all going to have bad times. And right now it's considered a bad time because pain is associated with it. I'd also like to think that pain is the best teacher too. From a movie that I watched recently, Pain is the best teacher. It's unfortunate, but it is the best teacher. So, I hope I can get back to my normal self and, you know, be creative and not hope, but I will. We're gonna take, I mean, it's a good thing to have hope. It's a good thing to have hope. So I'm not gonna take away the power of what hope is, but it's more of I will and it will be. Okay? So again, I just wanted to record this moment right now. It's literally like 12:25 in the morning. You know, I went to bed at 9, taking my medicines, and I started having crazy pains around 11 o'clock, shooting from, well, my back is already like tight and tense because I've been laying down for hours, for days. You know, I'm only getting up and I'm walking very careful not to, you know, spark any inflammation, any shock within my legs and nerves. Sciatica is real, and people have it in different levels. I wouldn't say mine is like level 1 or whatever. Like my pain has been between, at the highest it has been like a 9, from 1 to 10. But because it's a nerve, you'll have so many different types of sensations, and sometimes you can have more than one sensation at the same time. So that's what I'm dealing with right now. But yeah, I'm sorry if I'm ranting, but what I hope for is once I reach normalcy that I can look back at this and realize that my mindset was strong enough to know and believe that I'll soon get back to normal, or at least 90%, you know, to where I can walk like normal. I know I may not possibly get to work out like normal. So when that time comes, of course I have to readjust, but you know, at least get back to quality of life. So I'm going to try my best to manage the rest of the night with minimum amount of pain, and stay encouraged. Don't beat yourself up and get out your head. Please get out your head. If you're going through something right now I'm going through something. So look at it as me right now going through something with you. Don't give up on yourself. And the thing is, to someone else, they may consider your situation not as serious. Then at times they would have to be in the same shoes as you to understand it. But then at the same note, everybody's mountain is different. My mountain may not be big to you, and your mountain may not be big to me. Now for me, I can speak for myself. A mountain is a mountain. So the fact that when you're in this world, as long as you're living, we're gonna have mountains. So we can't compare our mountains with one another. So I hope and know, hey, let me take that back. I don't wanna hope, but know that I'm gonna get out of my mountain. You're gonna get out of your mountain, okay? That's all I want to say tonight while I'm in my pain at this current moment. And there has to be a reason for me recording this, because like I said in the beginning of this clip, I normally wouldn't share the pain that I'm going through in real time. But I think it's necessary. And another thing that just crossed my mind, if you followed me long enough to when I first started my YouTube channel, and I had mentioned why you know, now I get why I've started it at this point. You know, sometimes you don't realize what you're capable of or what you can accomplish until that time comes. You know, sometimes you'll be ready when it's time for you to be ready. But what I'm saying is, me making the YouTube channel when I did 2 years ago, and, you know, getting the followers, getting the engagement, and just accomplishing, you know, 1 month at a time, 1 day at a time. And it's like, wow, why didn't I start this years ago? And one of the things I said was I was afraid of judgment, you know, at times. And I've gotten to the point where I don't care about negative things. I don't care about the negative judgment. People are going to say whatever they want to say, and that's cool. The only thing I even care for or have the energy for is for the people who show me love, who appreciate whatever it is I do. That's all I have time for. That's who it's for. But then you start to also learn, or for myself, I've learned that it's okay to be vulnerable. Because at the end of the day, we're all human. We are all equal. And so if we are all equal, why is it that I can't share my downs? You know, many people have done it. You know, I don't have to share my downs. You don't have to share your downs. But since I guess I have the platform now and I've gotten to this point, this is my journey. So why not share it? And hopefully it touches the right ones who need a little encouragement from me. So this clip was longer than I planned on, because like I said, I'm still dealing with the pain. So I'll probably take another Tylenol. I got a whole bunch of pills, but they got too much information on it, so I won't share it. But yeah, I'm gonna take another Tylenol. So keep the faith. It's gonna be okay. It's gonna be all right. We're gonna make it. It may not happen overnight. It may need a little bit more time, but if you're like me, where it seems like we need a little bit more time, use that time to do your self-reflection. Do some self-reflection. Reevaluate some things. So when it's time to get back on your feet, you can move on a different vibration. It's okay to be still. Maybe this was my season to remain still. I look at it like that too. But yeah, it's gonna be all right. All right, good night. All right, wish me luck, y'all. I'm about to get my massage therapy, more so for my muscles, so it's like muscle therapy. I'm hoping that it gets me some extreme relief. So what's up, everybody? Today would be over a month now, you know, dealing with sciatica. And I'm sorry I wasn't able to provide more footage of the massage experience. I guess when you're in pain, you know, you really don't care too much of trying to, well, it's not that I didn't want to capture anything, but it was just the fact that was there, you know, mainly focused on getting the therapy that I needed. So just to kind of explain more of what I was getting into, you know, a friend and colleague of mine suggested going to this particular place, which they provide, you know, muscle therapy, muscle massage therapy. It's located in Dallas. Dog. It's located in Dallas. And yeah, so I'll provide that information below. If it's not in the description of this video, it'll most likely be on my pinned comments. But, you know, definitely give them a go if you have any, you know, sciatica, pain issues, and or sports injury of any kind. But I mean, you know, you're going there with the intent of getting a massage with intention. You're not going there for your basic massage or like a relaxation type of massage. No, this place or the people that work there or the people that work there, they're there to provide healing with their massage techniques and skill sets. So yeah, so yesterday I wanted to kind of provide the information now of my experience, but after that massage, you know, I kind of wanted to just, you know, just kind of relax, you know. So right now, quickly, I just want to share that, you know, my massage person was Miss Beja. They have a couple of other people that work there, but everybody specializes pretty much in the same level. So, you know, I met with her. I kind of explained her what I've been dealing with for the past month, both personally, as well as just the history that I've been having as far as like, you know, my visits with my doctor, with the spine situation, with my stenosis diagnosis, with the sciatic nerve and how problematic it's been, where my problem areas were, from the L4, L5, S1 area of my spine. And then again, I also was telling her a lot of the different research I've been doing since having this pain for over a month, and, you know, being in-house for several days at a time. You know, I do a lot of research at this point, you know, with things that matter, of course. And so I've kind of found how the piriformis muscle can also be entrapped. And, you know, for any of you that had followed me for some time, you know, a lot of my workouts, I would say, mainly focuses on lower body, a lot of times with the legs and the glutes being my main targeted areas that I focus. Not saying there's nothing wrong with it, but I will admit that most of the time when I work out, even for the countless times that I don't, you know, record it or share it with you all, a lot of times I don't stretch like I should, you know. I'm more of the person that likes to just go in and get it, you know, but I do make sure to inform all of my followers who do follow me for fitness, you know, inspiration, ideas, and motivation, to make sure that you stretch before and after. And I'm highly now an advocate in suggesting that you always stretch 5 to 10 minutes before and 5 to 10 minutes after, or even incorporate yoga into your fitness, you know, routine at some point in time. Because everybody's going to experience, you know, at least moderate back pain one way or another. But, you know, my situation just became more serious, not only with the wear and tear of certain things that I do, you know, in my normal life, where it be the type of workouts I do. I know that, you know, running outside on the pavement has a lot to do with it as well. So for those who are running out on the streets, you know, make sure that you have comfortable shoes that are for that type of running, if you're not running on a turf or a treadmill on a day-to-day basis, okay? So just be mindful of that, because a lot of that can shock and wear and tear your spine in itself. It could promote a herniated disc or a slip disc or anything like that. So just be mindful and just take care of your body, because I would not wish this pain on nobody. So going back to the massage therapy. So with that being said, you know, I shared a lot of what was going on with me, and she was able to kind of put together kind of like a customized massage session for me. And so, of course, you know, you strip down from your garments or whatnot, and, you know, you lay on your table. And of course, there was like, you know, very abstract therapeutic type music playing in the background just to kind of calm your mind and your body. And the thing that, you know, she informed me of was to just, you know, make sure that my breathing was sound, that I was able to just kind of like relax as much as possible. And I've learned within this whole experience overall is that my mind is always on the go. It's always on the go. I'm constantly thinking, and sometimes that's a good thing, but most times it can be a bad thing, because a lot of times, you know, when you're thinking too much, it can get in the way of what's important, I guess you can say. And a lot of times, from what I've learned now, is that I kind of let things that I may not have control over bother me at times, you know, because I just want things to be done, or I want things to be done in a right way. But I've learned to let go of those things. I truly let go of things that necessarily don't matter to me. I can't let things that don't matter to me, and it festers into my psyche. Because whatever happens in the mind that stresses you out will soon grow into pains within your body and your system. Stress is a problem. It can truly become manifested into physical form. And I think that was a little bit of what's going on now too with my life, but it's all a learning experience. And so I'm hoping that that tip can, you know, encourage you to learn how to just let things go. Let things go, be easy. Let things flow the way it needs to flow. As long as you have control over yourself, that's all that should be your concern. Anything outside of that, you just learn to be grounded in your peace and your center. And that's why I always promote, you know, positive energy, positive vibes. But like I said, it's a practice. You know, no one's perfect. Everybody has a life outside of what they're not showing. And that's why, you know, it's okay to be vulnerable. It's okay to share the downs. It's not always about the wins. Sometimes you have to share the downs, and that could be the win itself. And the one main thing that I've learned too is also that, you know, pain is the best teacher. A lot of times we're not going to get it when we're in our normal day-to-day routines. Sometimes we have to be slowed down in predicaments like this. Maybe it may not resort to pain in this type of way, but hey, like I said, you know, this was a way to kind of, you know, just slow me down, to regroup, reassess, and remap what it is I need to do moving forward. So that's just my journey. Going back to the massage again, and I'm sorry, but this is, I think with this whole video, even in the midst of the pain that I'm going through and what I'm sharing, this is to provide hope. This is to provide motivation for those who are in situations like this where you feel like you're trapped in your body because it's not moving or acting in the way that it used to be. So it's like unfamiliar pain, excruciating pain, and it's real life, you know. Somebody can be watching this video right now dealing with the amount of pain I was dealing with, or even more, and you're feeling like giving up. Trust me, I understand. I totally understand. But you have to lean on. I mean, it's okay to do research too, but don't let it put your mind in overdrive. You know, seek help, of course, you know, whether it be a spine doctor, your regular PCP, any of those things. If you're fortunate to have people who work in healthcare, because if you're fortunate to have people that work in healthcare and have information and knowledge that they can share with you so you can go about navigating this the right way, then please do so. But there are ways to get over this. And not only when you get over it, but now you have to kind of move in a different way to prevent, you know, even the flare-ups to happen. So, you know, I understand what it is I have to do moving forward. Back to the massage. Sorry about that again. But so of course, the glutes is where a lot of even though my spine situation is one thing, but that's not what they specialize in. Theirs is more of muscle and I guess you would say somewhat of the nerve, because a lot of the nerves are intertwined, or the sciatic nerve itself, it runs down, is intertwined and aligned with your muscles as well. So because I have a lot of muscle in my glutes too, she first started working from my feet up to the gluteal area, which is your butt. And so she kind of gradually pretty much started at like level 1 as far as pressure. But even when she got up to level 5 as far as pressure, I could tell not only is she passionate about what she does, but she understands that I'm already in a lot of pain, and she's doing certain techniques and I would say certain techniques and certain approaches when I wanted to say I hope I'm saying it right, but the fascia, whatever, and that's basically like I believe the lactic acid, or it's some type of acid that builds from just a lot of intense muscle movement when you're lifting a lot of weights, or if you're just an intensive when you're doing intensive workouts. Like I say, you see my workouts where I do weights a lot of the time, a lot of lower body workouts, a lot of HIIT with weights and stuff like that. So that's why I say I encourage that you do a lot of stretching. Also, if you're working out a lot, if you're not getting massages, it doesn't even necessarily have to be muscle therapy, but even if it's like a sports massage or a person that's just really good at removing a lot of those acids in the different areas that you work out most, it's highly suggested that you get those done at least twice a month, and that'll kind of maintain and also prevent any future injuries. Because if you're not mindful of getting your muscles more relaxed, and also if you think about it, a lot of bodybuilders, the bodybuilders that we know of and that we see, I would tell you 9 times out of 10 they're getting massages, because I remember there was a cartoon of a bodybuilder who didn't get massages, in one of those very dramatic cartoons. And it was like all of his muscles were just twisted, just in crazy, crazy pain. Yeah, you're working out, you're breaking down muscle fibers, and it has to recover and repair with rest and stuff like that. But stretching is very important to that whole process. That's one. Rest is very important. But massage therapy, any type of massage therapy that you can get, please get it. It is very, very important that you get it. So she did a lot of course, applied oils on my skin, just to be, lubricated to well enough to where she could kind of massage in smooth motions. She used her elbows and forearms to really just kind of like get inside and spread the muscles, because my piriformis muscle could have been entrapped too, along with the whole spine issue. So all of that is probably what's making my experience that I've been having very, very painful, because everything just kind of shoots down from the top of from the mid part of where the piriformis muscle is all the way down to my foot. And a lot of times, I have to get up, not even a lot of times, for the last month, I have to get up very slowly. I have to sit down very slowly. I have to lay down very slowly. Everything I'm doing is so slow. It's very crippling, the extent of what this pain I've been going through. So with that being said, after she did all of that, and then it was also my first experience and first time getting cupped. So she had applied a lot of different cups, starting from my foot all the way up to the left side of my body, pretty much. And then I told her, of course, with my left side being so weak because of the sciatica pain, that my right side of my body has been overcompensating for my left. And so my right side, or at least my right shoulder, has been doing a lot of the work, especially my leg too. If there is at any point that I need to bend down, if I drop something, whatever, I have to do it very slow. So it's putting a lot of strain on my left leg. But thank God, my legs are strong anyway, despite the sciatica on my left leg. So it's just a lot, man. And it's been a very, very hard, challenging, complicated journey, but I had to look at it like I mentioned before earlier. A lot of times, whatever hardship we're going through, a lot of times we see it as it happening to us, and it's like, why is it happening to us? But you really have to change your way of thinking. I know it's hard, but a lot of times we have to look at it as it's happening for us, So with all that being said, I really recommend you going to a massage therapist. I know a lot of people that are watching this too, a lot of my followers, you're probably not even located in Dallas, and that's okay. Just look up, you can look up on Google and find a local muscle massage therapy clinic that's somewhere around your area, and then just kind of see what kind of services they provide. And, if you're kind of going through situations like this. But then again, you can also just find any good massage parlor of your choosing for those who, you know, work out a lot or just work out, you know, in high intense levels of different, you know, fitness routines that you may do on a day-to-day basis. It's especially when, I mean, I'm only 36, but these things can happen even for people younger. It just depends on your lifestyle and what it is that you're doing that can cause wear and tear on your body. So we have to be mindful of that. And I also recommend that people, you know, if you can take turmeric because that helps with inflammation as well. I don't know why my voice keep cracking or whatever, but hey, it is what it is. It is what it is. But yeah, so I'll put the information of where I went. But there's a lot of other places too in Dallas as well that provide good services just from my research and people that I talked to before. But I just decided to go with this one, be it with the colleague that was experiencing pretty much the same thing that I was experiencing. And therefore, I was like, you know what, let me go there and see what it's about. Here we go. My voice is cracking again. But yeah, so after that massage was done, I did a 60-minute massage, and, you know, she went a couple minutes over just to, I mean, like I said, she was very passionate, very in tune with just really working with my body. She realized that there was just a lot of tense, a lot of stress that was in my system. And there was only one other massage or masseuse that I went to that was in Florida. I forgot his name. It was a Latin guy. And he can tell that there was just a lot of stress going on or has been going on in my life. And, you know, I kind of shared with him just what's been occurring or whatnot. But, you know, I really appreciate those who are extremely passionate and gifted, you know, in the category of just massaging, because that means they work with so many different bodies, and they can tell when it's something that's, or something has traumatically happened to someone or an individual. A lot of times we go through very bad traumatic times, and those times somehow stay in your body in some way. Stress does that. I mean, like I said, anything traumatic, stress-like, can become manifest into physical form, and therefore our bodies, unfortunately, would get it in some way, you know. So we have to be very careful, and that's why, you know, the mind and the body is in tune with one another. So we truly have to practice learning, letting go of things that we don't have control over, practice in protecting our peace more, and not allowing people to take us away from that. You know, you really have to stay firm with who you let around you, who you let speak with you or speak to you. I remember I had one dream one night where I don't know why my voice keep doing that, but it's okay. It's cool. It's life. It's real. But yeah, so one of the dreams that I had was, it was a message that came to me, and it was basically saying conversational investments. And basically the meaning that I got from that is, you know, a lot of times people gossip. You know, people make a living off of gossip. People comment and stir up gossip, make up allegations without true evidence or facts. The thing is, you know, it's an A and B situation, and you're C, but you had nothing to do with A and B. You may have heard rumors from D and E and F and G and H and so forth and so on, but you're not in the mix of what occurred. You weren't there. Or, I mean, it's countless ways of gossip and how it's grown into something so crazy, especially with social media. You know, everybody has opinions, and opinions turn into gossip a lot of times. But you really have to just remove yourself from that too, because especially if you're the recipient or the topic of discussion, you know what I'm saying? You're only human. And whether it's one person or hundreds of thousands of people talking about you, man, it's hard. It's heavy, you know? And really none of us, even if you're the one that does, even if you're the individual who stirs up the gossip, you know, everybody's in different wavelengths of their life, but they may not even have the capacity to think, you know, what if I was in that person's shoes and it seems like the world you know, is against me or doesn't feel me or doesn't love me or doesn't like me. And it's okay if they don't like you and stuff like that. You know, hell, not everybody liked or loved Jesus. You know, everybody talked about him. But I don't know why it's so hard for people to find kindness or to give kindness. And I understand that we're human and everybody's capable of being bad and being good. But it gets to the point where people are moving in a way of, I don't know, they're in the movement, and sometimes it's unintentional. But I mean, they done it so much that it just becomes an everyday thing, you know, where they, I mean, where they have to say or try to bring somebody down for whatever reason. Like, I don't understand what people get from that. Maybe they say misery loves company too. So maybe you can put it that way as well. And to be quite honest, I don't even know how I got to this subject. And if you're still listening, hey, I appreciate you. But hey, sometimes when you go off track of whatever conversation that you're having, sometimes you can find some gems in it. So that's why I really don't care, you know, if I kind of talk about one thing and then I kind of go off track a little bit. But sometimes it's for me to learn something from it, or you, if you're still listening. So I appreciate it. But let's try to get back on track real quick so I can make this video as short as possible. So anyway, yeah, oh, well, let me say the good news if you're still here. So the blessing is that, so with my spine doctor, the plan was for me to get the epidural steroid injection, which would be injected in my spine in those 3 areas that I mentioned earlier, which is the L4, L5, and the S1. And so this particular injection will provide much needed relief. A lot of people get this particular injection once you reach a certain point of medications not doing exactly what it needs to do. And although I'm young, and, you know, he suggested and also pointed out that, you know, with my age, normally within 4 to 6 weeks, pain like this would normally kind of like, you know, take care of itself. Because of course, with the pain happening, you know, currently or recently, when it first started, you know, your body still needs time to kind of like heal and process those nerves and stuff like that. And 9 times out of 10, it'll heal on its own. But my pain kind of progressed even with all the medications I've been taking. And so, and I'm sorry, I probably look busted right now, but hey, life is life, and life is life. And we don't all look bomb, you know, on a day-to-day basis, but it's okay. But yeah, so, he was mentioning how, you know, I could do the injection. Now, the worst part of this whole situation is that all this pain had happened at the end of the year. And if you know anything about healthcare, it's really hard to be seen during the holidays if you don't already have things scheduled beforehand. And then you have insurances and things like that where authorization has to be renewed and things roll over. So it's kind of like, you know, you kind of feel defeated at times because it's like, wow. So the next available would possibly be like January 29th for me to be seen. And it's like, wow, like I have to deal with this pain. I've already been dealing with it for about a month now. And now I have to wait another month to get these injections that can possibly, you know, get me back on my feet, you know. And so long story short, you know, I had seen him recently for an appointment just to kind of do a follow-up and, you know, this, there, and that. And thank God, you know, he was really looking out for me. He went above and beyond, and he called or contacted a colleague of his and to see, you know, if he could fit me in sooner. And thank God, you know, he called me, his friend, colleague called me maybe an hour and a half later and was like, we can get you in next Wednesday. So in a couple of days, I'll be getting this injection. And, you know, I prayerfully and feel confident that this will truly, truly help me get me back on my feet. Of course, when you take a shot like this, you know, they suggest that, you know, you don't do nothing for at least 24 hours, just kind of like chill, you know, let the medicine marinate and do what it needs to do. And then you normally follow up with your provider 2 weeks later. What is going on with the voice, man? But yeah, so I'm really looking forward to that, and just ready to bounce back and, you know, entertain y'all again and engage with y'all again. So I know it's been I know it's been a long minute, and I don't know if this will be the last clip of this particular video, but you know, I'm kind of grateful that I was able to document, you know, a little bit of this struggle and a little bit of this journey. And I really and truly hope that it encourages those who feel like you feel trapped in your body, you feel like giving up, you feel like you're hopeless and stuff. And trust me, I've had those thoughts. I felt like that, you know, not saying, you know, it was deep, you know, deep into thinking, you know, of something dark to do to myself or anything like that. Nothing like that. But, you know, for someone who's just physically fit and then to go from that to feeling crippled, you know, it's really hard to accept, and you kind of feel like you're not going to get back to normal. So just give it time, you know. Just give it time. Do what you need to do. Maybe do what I've done, you know, trying to get this resolved. You know, I still have a piece of the journey that I have to go to, which is getting this shot and hoping and knowing that everything will work out for me. And that's the thing. We're gonna go in, because I'm not sure when I'm gonna post this, but whether it's still the end of 2023 or if it's 2024 already, we are not going to say, you know, try or I hope. We're going to say it will. It is done. That's how we should be thinking. Your words definitely have power, and your mind does too, as you can see. So, you know, let's get back into a healthy way of thinking, protecting your peace, you know, remaining in a peaceful state, not letting anything, you know, penetrate your thoughts, or letting people, you know, penetrate your thoughts with any negativity of any kind. Because that stuff can manifest, man. It can manifest. It truly can. And whether you're feeling down in the dumps, whatever struggle or situation you're going through, it doesn't even have to be physical. It could just be a state of life, of whatever you are in life. It's temporary. And as long as you have determination and faith of a mustard seed, it's going to work out. Do whatever you can for yourself and or your family. Do whatever you can. It's going to change. It's going to work out. You matter. And we're going to get through this, okay? So until next time, because I'm still not sure if this is going to be the last clip of it all. I may add one more clip after the epidural situation, because I'm pretty sure people are probably curious about that. And whether or not I share it or not, you know, definitely do some research on epidural steroid steroid injection for sciatic nerve pain. There's a lot of information out there, and I looked at quite a few videos that explained it. So yeah, that's what I'm getting. So until then, stay positive, and I'll see you next time. All right, everybody, it is the day that I get the epidural transformational injection in my spine. It's 7 o'clock in the morning. I've been waking up a couple of times throughout the night. You know what? I wasn't even nervous about this procedure. I'm a little bit nervous right now, just a little bit. You know, I just want to make sure everything go right, but it will. Everything will go right. Of course, you know, you really can't eat a few hours before the procedure. So even though it's 7 o'clock and my procedure's not till like around noon, I'll just consider it fasting this morning. And I'll probably take pain medications anyway. I heard that it's okay to take pain medicines just to kind of, you know, added insurance that, you know, I really don't feel any pain. I won't be sedated though. It'll be local anesthesia, which is called twilight anesthesia. So I'll be awake for this procedure. So yeah, I'm really looking forward to it, and I'm ready to be pain-free. That's the answer I'm looking for. And So, yeah, I'll see if I record a little bit of myself in the hospital, and I'll let you know how it went once it's done. So I appreciate you for watching this far. Yeah, this ain't a fun video, but I'm pretty sure it'll motivate or inspire or at least inform those who may not know what this is all about, and just, keeping up with me and what's going on in my life. All right, until next scene. All right, fam, so I'm getting myself prepared for the procedure, and wish me luck, but I don't need no luck. I know it's all gonna work out. I'm changing into my attire so they can have better access to do the injections in my L4, L5, and S1. So I will come back when this procedure is done. I'm gonna have something called the twilight anesthesia, so I will be awake. A little nervous, but I know it's all gonna work out. So follow up on the next scene. All right, so any minute now, we're gonna go ahead and begin this procedure. And I'm so looking forward to this pain relief. I'm ready to, bounce back and get on my feet. It's been a long journey, actually, so stay tuned, and I'll let you know how the whole process went. And I'm pretty sure it'll be an easy and smooth process overall, so I'm not even gonna sweat it. We're gonna get this in and out. What's up, everybody? So I finished the procedure, and it really was not that bad, actually. Just like you would see or find if you were to look for how transformable or epidural injections work, basically, it's your doctor who's going to be doing the injection, followed with a couple of his team members. I had the IV and vitals done and everything like that. And so the purpose of the IV, like I mentioned before, I was getting the twilight anesthesia, where I'll be aware. So it's like a mild sedation. So once I got to the room, the operating room, they flipped me over and, on my stomach, and placed my face, kind of like when you go get a massage done, your face is inside like a hole or whatnot. So I was there. And then that's when they went ahead and gave me my sedation, my mild sedation, the twilight anesthesia. And, the team has to kind of like review what they're doing with me. And once he sterilized the area where he was going to place the injections, he had to first inject me with numbing. And that was probably the only thing that, somewhat hurt, it was basically like a pinch, with the needle going in, and then whatever medicine he had to inject, it was like a burning sensation, which lasted 2 to 3 seconds, but it is what it is. I think he did 2 or 3 shots. I know he did 2, but I'm not sure if he did 3, because I know he was doing 3 areas of my back. But other than that, he did that, and then he allowed it to do its thing for a minute or 2 before he went ahead and did the initial injection, the epidural steroid shot or whatever. So yeah, it lasted probably no more than 5 minutes. The only holdup was just kind of waiting on my provider, because I did notice that he was working on somebody else, giving them the same type of injection. But other than that, it literally lasted about 5 minutes, and then hopped off of the operating table back onto my bed, and closed out with the nurse, just to kind of make sure that everything was going right. I wasn't feeling any shooting pains or anything like that, because the provider, he did kind of like share, the different type of risk and stuff like that, just, following safety protocol and everything. But overall, I'm glad I finally got this done. I'm pretty sure everything is gonna go out or go the way it needs to go. And just looking forward to bouncing back. I'm gonna still take it easy for a minute. They do say this particular steroid takes anywhere between 1 to 2 weeks or 10 days in general, just to be at its max benefit, or to benefit me, I guess, the best. But other than that, I will have to take it easy today. I will be resting today. I'll be able to eat what I want to eat today. But yeah, so I think that's going to be the end of this video, the end of this journey. I appreciate you. You've been watching it this long. I can't wait to start sharing new videos with y'all again. And you know, my heart goes out to anybody that's been going through anything with pain or physical pain, especially to my sciatica fam. This is no joke. I'm hoping that I'll ever have no flare-ups in the future or any situation where it gets the same or the worse, because it was totally challenging. But like I said, I'm an advocate that everybody needs to stretch. And if you work out a lot, make sure that you see a masseuse, especially somebody that specializes in sports medicine. It is very vital that you get those massages done, because it could definitely prevent you from getting injuries like this. I mean, it's happening now more than ever. You know, I'm hearing almost every week a couple of people getting back or having back pains, back injuries and things of that nature. So I'm signing out, and we're gonna hope for some big fun for 2024. So positive energy, sending it out to all of y'all. Thanks for watching.